Inflation moderated notably in March as a decline in gas prices helped to pave the way for the slowest pickup in prices in nearly 2 years, providing relief for many American consumers and some evidence that the Federal Reserve's campaign to raise interest rates and cool the economy is beginning to work. Senator Tim Scott of South Carolina, the only Black Republican in the Senate, announced today that he is launching a presidential exploratory committee, a move that signals in the strongest terms possible his intent to enter the 2024 race. The Biden administration, seeking to reassure abortion rights activists without provoking the courts, is privately promising an array of liberal groups that it will wage a fierce legal battle to preserve access to abortion medication, while also developing contingency plans in case those efforts fall short. Legal abortions fell by 6% in the 6 months after Dobbs. While clinics in some states expanded capacity, bans prevented thousands from getting legal abortions. Should college come with trigger warnings? Well, at Cornell University, it's a hard no. When the Student Assembly voted to require faculty to alert students to upsetting educational materials, administrators pushed back. Kwame Brathwaite, a photographer whose visceral pictures of cultural figures like Muhammad Ali and James Brown, along with Black fashion models and ordinary citizens, were hailed as a catalyst of the Black is Beautiful movement of the 1960s and beyond. Sadly, Kwame died last week at the age of 85. Justin Pearson, the Tennessee lawmaker ousted last Thursday by the GOP legislature, was reinstated by a unanimous vote today by the Shelby County Board of Commissioners. This comes 2 days after the Nashville Metropolitan Council voted unanimously to reinstate his colleague, Justin Jones, to his seat in the legislature. The Tennessee Three, as they are called, are continuing to push the GOP-controlled body to pass common sense gun laws. You are watching and listening to Areva Martin in real time, and I'm your host, Areva Martin. This is your one-stop destination for today's trending news, expert analysis, and my unfiltered opinions. This is hour 2, so we're taking your calls at 1-800-920-1580. Also, if you are watching on KBLA TV, drop us a comment or a question. We will talk about it. Your question, we'll answer it on air. In this second hour, we are kicking off Black Maternal Health Week. Yes, this year's theme is Our Bodies Belong to Us, Restoring Black Autonomy and Joy. During this week, people around this nation, including the Biden-Harris administration, will be raising awareness and promoting activism to amplify the voices and perspectives of Black mothers and other birthing people. This week begins today, April 11th, and April 11th is also known globally as the International Day for Maternal Health and Rights. I'm so excited in this hour because I have 2 of the nation's leading Black maternal health experts joining me to help us make sense of why this week is so important, why we celebrate it, and what we all can do to be a part of the change, part of the solution to address Black maternal health rates. So when we come forward, you'll hear from my experts and we'll talk about Black women and the birthing process right here on KBLA Talk 1580.
Impact the Black community for some.
Today kicks off Black Maternal Health Week, and joining me in this hour as we acknowledge this week are Kimberly Seals Allers. She's the founder of the Irth app and executive director of Narrative Nation, and Rachel Nix is here. She's the founder of Birth Queen. Thank you so much, Kimberly, and thank you so much, Rachel, for joining me for this important kickoff show as we acknowledge Black Maternal Health Week. Kimberly, my friend, it's been a minute since I've seen you, but I'm so glad to have you on the show today. I see all the great work you continue to do in the community. You are making such a big impression, raising awareness about Black maternal health. So tell us why this week is so important. Why are we celebrating, and what are we celebrating this week?
Thank you so much for having me, and it's always good to see you, Areva. This week is so critical because it's around raising awareness, right? Not just on the statistics, which people love to tout, but also the solutions, right? The community-centered solutions that exist and, quite frankly, have always existed. So Black Maternal Health Week, for me, is an opportunity around lifting up and amplifying the solutions that we know exist in our community and making sure that others know about it, making sure those solutions are funded, properly resourced, and that they get the national attention, the policy support, and everything else that they deserve so that we can eliminate these racial disparities which have persisted for far too long.
Well, let's talk about, Rachel, some of these statistics. We know that Black women are 4 times, and depending on where they live, even that 4 times can be 8 times, 10 times, 12 times more likely to die in childbirth than white women. And some reports say it's more dangerous for a Black woman to give birth in the U.S. than it would be for her to give birth in a third world country. Tell us, how is it in the most advanced country on the planet, as rich as the U.S. is, as advanced as we are from a medical and technology standpoint, why is it so dangerous for Black women to give birth in the U.S.?
You know, it's not something we want to accept, even as Black people, but it's the color of our skin. Racism is killing us. We are not broken. The system is, and it has been since the inception. Obstetrics was created by white men for capitalism. It wasn't about care. And so they eradicated midwifery, and tried to, and we're bringing it back, and we know it works. And guess what? Every person in this country was born in the hands of a Black woman and survived and thrived. And so the work that Kimberly, myself, and everyone else is just reminding us what was working from Mother Africa to America and continues to work. So just making sure we reinstate support, trainings, and access to midwifery care. And then also try to find solutions within a hospital setting to dismantle that racism. Doulas are a great solution. There's wonderful programming that's happening, you know, within the structure that we have now to also support and limit that. But I think the other thing is really important. It's not a low income thing. Studies show that the new median, income is $128,000 for Black women that are being affected. So I don't want any Black woman who's, making a lot of money to think this can't affect her. It can. You are not immune to your skin color. So it sucks. It's painful, but it's very real. So we all need to pay attention.
Yeah, a really good point about it doesn't discriminate based on your socioeconomics, your job, your status, the number of degrees that you have just doesn't differentiate. But Kimberly, help us understand historically that this 4 times more likely to die in childbirth. Is that number getting better? Is it getting worse? Because it's so shocking of a number to begin with. But, I wonder if there's some good news, like maybe it's gotten better or it's getting better.
Well, I think nationally that number has remained fairly consistent. It's actually widened from 2 to 3 times to 3 to 4 times. Also, we know that the pandemic only exacerbated this disparity, and we saw Black women being still disproportionately dying during the pandemic. And those studies showed the same thing, like that disparity was actually widening. In some places it has narrowed slightly, but really, to be honest, nothing at any level that's really worth any applause. We have a lot of work to do. Obviously, any death is one too many. And when we look at disparities, we have to remember that, again, they're able to get it right for some, right? And so we're not asking for anything special. Just give us exactly what you're giving the white women and we'll be fine, right? So at least help us get to that point. And I think that's what we want to say, like we are asking and we are demanding fair treatment, right? And that we should have bias-free birth experiences, that we should be suffering under the same exact disparity as everyone else in this country, white women included, because we know that our country, as you mentioned, is also at a disparity compared to other nations. But Black women are carrying that burden at the highest levels, and we're paying the price, and the country owes us more.
Give us some concrete examples, Kimberly, of what some of those disparities look like. In real time, when a Black woman goes into a hospital to give birth and a white woman goes into a hospital to give birth? Give us some concrete examples of what some of the differences are that you've been able to track in the work that you've done.
Yeah. So right now, the number one negative experience being reported in the Irth app nationwide is my request for help were ignored or refused. The most commonly reported negative experience in the app, my request for help were ignored and refused. Number two, nationwide, we have reviews from 47 states. My pain levels were dismissed, right? Number three, I was scolded, yelled at, or threatened. And within the top five is I experienced assumptions based on racial stereotypes, right? And so what we're seeing is that the racism and bias, the story that's been told about Black women as mothers throughout history, when we look at how things change, when we had economic value to the system, right? Because when we were enslaved, we were breeders and feeders. We had economic value and could actually produce children of economic value. But ever since that ended, if you look at it historically, we have been devalued within this system. And so we see that Black women are disproportionately saying that their pain levels are being dismissed. We know that it has been a common thread in every maternal death story. California just had 2 additional maternal deaths within the last 60 days. I mean, it is really something. All of those stories were about people's pains being ignored, people's requests for help being ignored, and this is consistent with our national data. And disproportionately, that leads to our demise, right? We know that our health system is not perfect. It has many flaws for everyone, but for some reason, Black women have a very similar complaint and report, and that is disproportionately leading to our death. The last thing I will say on this is so important when we talk about racism. For example, we see Irth reviews all the time where people feel like, oh my God, I've read a review I was sharing the other day, a prenatal review where someone went to their prenatal appointment with their husband and was asked to come back with their marriage certificate. We see reviews which have
wait, Kimberly.
Okay, we can pause.
Hold up.
We can pause.
That's common.
Who asked for the marriage certificate? The doctor?
Mm-hmm. The doctor, the office administration said they needed to return with a marriage certificate. And this is what I'm saying. There's
before they could treat this pregnant woman.
Before their next visit.
And what with the marriage, was it about insurance? Like, I need proof that you're on this man's or woman's insurance? Marriage certificates, let me just say, are triggering for me. Because I don't know if I told you this story. I went to TSA to get my TSA known travel number, and on the website it tells you what to bring. It says bring your birth certificate and bring your federally issued or your official ID, your license. I get there, and dude is like, "We need your marriage certificate," and 30 minutes later, I'm still asking, "Why do you need my marriage certificate?"
Right.
Do not tell me with prenatal care, doctors are asking women for a marriage certificate.
And they're actually not. There's nothing related to that. But what we know is that we see this in the reviews. People are making judgments, right? We see reviews where people are being judged about whether they're married or not, how many children they have, the spacing of those children. If your children don't have different fathers, these are judgments that they're making about Black women and Black families in general. And they use those judgments to determine what level of care you are going to receive, right? I want to remind people that when we're talking about racism, we're not necessarily talking about epithets and tiki torches and N-words and slurs. No, we're talking about the ways that people look at your skin color and make a judgment about you, or that they rely on stereotypes and assumptions and tropes, right? And then they make a judgment about you, and that is impacting your care. So we think about tropes around Black women, us not being listened to. There was literally medical research, as you know, Areva, around that we didn't experience pain the same as white people. This was being taught in medical schools as early as 2016, not that long ago. This was still a commonly held belief. And so when we look at the ways that racism has impacted research, medical schools, culture, and people's biases and perceptions about Black people and our family structures, we see that this is impacting how we receive care, and that we are disproportionately dying because of it.
Yeah, and so Rachel, I know you were nodding your head. You've had situations where people have reported to you that Marriage certificates were asked for as they were seeking prenatal care.
Yeah, during the pandemic. Well, first of all, that's the other thing. When you go to have a baby, you're stripped down, right? Like you're not wearing, jewelry and bags and all the things. Like you're just in the raw, which is how it goes. But yes, I've heard multiple times women say, I was asked, where's my husband? And in particular, during the pandemic, you were only allowed like one person. They had other children at home. He was with the kids. She was with the doula. I've had women say, I wish I kept my, I did my hair or before I gave birth to identify or wore jewelry. I've absolutely heard the marriage and or the I wish I had identifying factors of wealth, and perhaps that would have affected my experience.
So don't go to the hospital to give birth if you are having a bad hair day, right? Don't go with your hair jacked up.
Because I braids up for my second baby, just in case.
I know we're talking about women in birth, but I'm thinking about my husband. Once he was going to the emergency room, and I mean, it's so ingrained in Black people. He said the same thing. He's like, "Oh no, I got to put on something. Got to get dressed." I'm like, "Fool, let's go." And he's like, "No. I'm not rolling up in that hospital looking crazy."
Absolutely.
And oh my gosh, it's really
every time
disgusting.
for the whole time with my children, I always had an outfit hanging behind the door for emergencies because I would not go to the ER with my children looking, as we would say, crazy. So there was always an outfit at the back of the door that was an emergency outfit because I knew that this is how they make judgments about us, and those judgments can impact the care you receive. It is just sad, but our reality.
Yeah, let me ask you ladies about Dobbs, because we've heard, it's been in the news, the abortion pill, this ruling by this Texas judge making it more difficult, for women across this country to have access to abortion care. How has Dobbs and that decision that overturned Roe v. Wade, has it had a big impact at all on Black maternal health? Because we know lots of women who are seeking abortions to save their lives. Because they have serious medical conditions and they need to abort the baby in order to live themselves, or abort the fetus, I shouldn't say the baby, to live themselves. So how, if any, is what's happening around abortion care, abortion rights, how is that impacting Black maternal health? Kimberly, do you see it having an impact? And if so, what kind of impact?
Well, I think the important thing to remember that this is all reproductive care, right? And that when we see our rights being attacked in our country to the point where, for me, I find our nation unrecognizable at times right now. We know that this will impact because people are expected to be forced into carrying a pregnancy that, one, could cause them physical harm, two, could cause them emotional, mental harm, and nobody cares about whether you're going to survive that birth. Nobody cares about that baby coming out and supporting it afterward. We still live in a country with no federal paid leave. And so this is just forcing people who should have rights about their bodies and choosing motherhood and choosing parenting into a situation. And when you're forced into pregnancy as a Black woman, your statistics, unfortunately, are saying that you're going to have a negative experience or possibly even something worse. And so we really have to look at the ways that all of this impacts reproductive health overall and people's emotional health. And I think that's an important part of the piece.
Yeah, Rachel, I was talking to a professor from UC Irvine Law School yesterday about these decisions on abortion medication. And she was saying there's not enough conversation about the dangers of childbirth vis-a-vis the relatively low dangers associated with abortion care. And that there's all this conversation about, well, in this one Texas judge's opinion, he talked about, saving women or preventing them from experiencing the trauma that he says, these are his words, that comes from abortions. But no recognition of the incredible risk, the safety and health risk associated with giving birth, particularly if you're a Black woman in a state like Mississippi.
Right. Was it Michelle Goodwin?
Yes, Professor Michelle Goodwin.
Yes. She's amazing. I was just at her Socrates at the Aspen Institute. So, yeah, I mean, we have statistics that abortion, the rates of death for an abortion are very, very low. But you touched on it. And I think what's really important to emphasize is that abortion is not just to release a pregnancy. Like, a woman's life truly can be at risk. Like, even for an ectopic pregnancy, and if people don't know what that is, like, a woman can get pregnant in her fallopian tubes, she will die. So it's not like people are like running to abort babies. I think that's the other thing with this narrative that they're pushing is like, oh, I can't wait to just get pregnant on accident and go abort my child. That's not what's happening. So I think we also have to be careful the way, like, the vitriol and the skewing of the story and the narrative when it surrounds abortion. It also, by the way, takes 2 people to get pregnant, in case they forgot about that. But absolutely, to piggyback off of what Kimberly was saying and what Michelle Goodwin so wonderfully illustrated in our seminar, was that all of this has to do with losing our rights as women, which was never the goal with the creation of this country, right? So it roots back to slavery. And we have to understand that any attack to any right for women, whether it's reproductive or otherwise, is an attack on our civil rights as women, period, right? We do not have autonomy over our bodies. And that is a very dangerous thing. To me, it should not be like, it just should be clear that we need full autonomy over our body in the same way that men have over theirs.
Yeah, I'm sitting here today, the mother of 3 kids. I've given birth to 3 kids, but I also had an ectopic pregnancy after my first birth, my daughter Michael, and I did not know about the dangers of ectopic pregnancies. I didn't know that they were deadly, that you can die. I just knew I was in a tremendous amount of pain, and my doctor told me to rush to the emergency room, and I get there. And she tells me, this is very serious. You got to have emergency surgery. And it's so funny. I can look back on it now and laugh. It was very traumatizing at the time, but I was sobbing. I was weeping on the table as they were prepping me for the surgery. And the anesthesiologist comes over and she's trying to soothe me and comfort me before she puts me to sleep for the surgery. And she says, you're a young lady, you're young. Don't worry about it. You can have another baby. Because she thinks I'm sobbing about, like, oh my God, this baby. And no, I wasn't. I was sobbing because the doctor had just told me, literally, like, if you hadn't arrived at this hospital in the moment that you arrived, you could have died. And so I was sobbing, thinking about my daughter, who was 4 or 5 at the time, that she could have lost her mother. I was thinking about my husband, my mother, my family. And my heart goes out when I see these women in states like Texas and Florida and the South who have to travel to New York and California and Illinois and other states because they, obviously not in a crisis like I was in, but have been told by a doctor that they literally could lose their lives if they don't have abortion care in a reasonable, quick period of time. And that's the part of this story that I think doesn't get nearly enough attention, is how dangerous pregnancy can be for some women and all of the major health challenges that it can present, and how women can literally lose their lives. So yes, I'm glad to see that we are able to expand the conversation about Black maternal health and talk about what that means in this conversation this country is having about reproductive rights and reproductive justice as a whole. When we come forward, I want to talk to you all about this year's theme, restoring Black autonomy and joy. Our bodies belong to us. What does that theme really symbolize, and what should we all be doing during this week of Black Maternal Health Week? Stay with us, KBLA Talk 1580.
Who's in charge? The hunting season from
Black Maternal Health Week, and in this hour, I'm joined by 2 of the nation's leading Black maternal health experts and advocates, Kimberly Seals Allers. She's the founder of the Irth app and executive director of Narrative Nation. And Rachel Nix is here, founder, Birth Queen. All right, this year's theme for Black Maternal Health Week is restoring Black autonomy and joy. Help us understand, Kimberly, Why this theme? I mean, let me just say the whole theme is our bodies belong to us, restoring Black autonomy and joy. Why this theme, and why is it important to really elevate the voices of Black women in this week?
Yeah, and I think when we think about our bodies belong to us, it's very much about what we were just discussing in terms of, the assault on our reproductive rights, and for us to assert and affirm that our bodies do belong to us. And so I think that is a real nod to the time that we are living in, where it is becoming questionable whether this country believes that our bodies belong to us. And it's time that we are stating that, living that out, affirming that in multiple ways across multiple channels. And then for me, the part about joy, which I'm super excited about, is really about, for me, rejecting the doom and gloom narrative that has been so common in Black maternal health, such a focus on negative statistics and sensationalized headlines of Black maternal deaths. I was looking back in 2018, I was writing about how this doom and gloom narrative was dangerous and actually was potentially harmful to Black birthing people. At the Irth app, we received DMs from people asking, should I write a will before I go into labor? Questions about preparing for death. And it's like, this is dangerous. And so for me, joy is about remembering that joy is our birthright. As you know, Areva, I started the Birthright podcast where I only share joyful Black birthing stories. So we're excited to center joy and know that this has been a big part of our work for some time. And so this idea that we can learn from joy, that we can actually center joy, and that when we remember that joy is our birthright, then we know that that should be the expectation, not just to survive, but to thrive and to have a good experience, a joyful experience, a positive experience. And so I'm really excited about centering that theme and that thought and that sentiment this week, and for me, every week.
I'm so glad you said that. I did a show during COVID on Black Maternal. It was during Black Maternal Health Week. And I had a young woman, I think she was in her early 30s. She might have been 30, exactly 30. And she told her birthing story. We actually won an award for this episode. And this young woman, she was so just, vulnerable and transparent about her story. But she also had some really good news in the story. And the good news was, despite a lot of bumps in the road as she got to the point of giving birth, including her doctor who left her mid-labor, like she's in the middle of labor and the doctor left for some unknown reason. But the new doctor that came in, white male, immediately goes to her ear. She says she's, in labor, she's in pain. And this doctor says, don't worry, I am going to listen to you. I hear you. I see you. And all the things that you talk about that we want medical professionals to do. Obviously, he had gotten the memo. He had been through some training. And she said it was the most reassuring. How frustrated you would be if your doctor that you've been with through this process leaves mid, push. But here comes a doctor that says, don't worry, I got you. I hear you. Anything you need, I am going to be responsive. And then she does have a very successful birth process. Her daughter, is doing really well. So there are, as you said, Kimberly, some really positive stories. Rachel, I want to go back to what you talked about in the first segment, and that was using midwives and doulas as a way of addressing some of the issues that Black women have in giving birth. Talk to us more about that. And are these types of professionals easy to find in cities around the country? And are they paid for by most insurance companies?
Oh, that's a big part of the work I'm interested in doing. So yes, midwives are not always easy to find. We don't have a ton of them. It's certainly a resurgence of that happening. But depending on where you are, you might not be able to have access to a midwife, and you most certainly might not have access to a Black one because there's far fewer. I want to highlight Beloved Birth Black Centering's work in Oakland, California at Highland Hospital. They have 6 Black midwives, and they're overseen by a beautiful Black male OB, Kevin Smith, who supports their their work. They are doing a group care model. It's working at a public hospital. They have bathtubs in the room. They have a mirror to look at themselves as they progress during their pushes. I'm born and raised Oakland, was able to visit real time, but I've been so excited and supportive of their work since they launched in 2020. And literally,
Rachel, help us understand, what does the birthing process look like with a midwife versus a traditional delivery?
So if we just bullet point the differences, and the only main difference with an OB is they're a surgeon. So their main tool is a scalpel. They can do a C-section and a midwife cannot. That's the main difference. But if you choose a midwife, your average visit is an hour, and an OB, it's 15 minutes. So no matter what your perspective is, if I call Kimberly to talk to her and connect as a girlfriend, 15 minutes is one thing, an hour is far different. You're going to be able to connect and uncover and support and empower way more in an hour than you are 15 minutes, right? And so a lot of our issues happen during pregnancy.
But wait a minute, Rachel, you talked about bathtubs. So no bathtubs in the room when I gave birth to these three little.
Yeah.
So talk about the bathtubs.
You don't have to birth in the tub, but a tub is a wonderful tool for pain management. I had very long, very painful labors. I was able to be in a birth center in New York City within a hospital setting. And so that was really helpful and supportive. So then a doula, the difference between a doula.
Wait a minute, another question about midwives. What's the training of a midwife? Are they physician assistants, nurses assistants? Like, what's their training? They're not MDs, right? They're not MDs.
They're not MDs. Most of them that practice in a hospital are nurses, and then they have a separate master's midwifery program. There are some midwives that are not. They have just done midwifery training, but in order to be a baby catcher in a hospital that's a midwife, you must also be a certified nurse. So you're getting full, I want to dismantle this idea that you're not getting full prenatal care or medical care with a midwife. That's really not the case. You're actually getting a lot more care from a midwife. And the approach is more holistic and caring, right? It's less pathological. They give you all the same tests, but as a woman who chose midwifery care over obstetrics, I felt cared for, and it wasn't this doom and gloom narrative. We did the tests, and then if there's something awry, they let me know, versus like, we better do all these tests. You know, I feel like all my friends that had obstetricians caring for them were just stressed about what ifs.
But Rachel, is a midwife able to deliver a baby in a hospital in a more traditional setting? So, you know, you go into a labor and delivery room, and the midwife delivers the baby in the same way that your OB would.
I'll be very clear with that too. If you have a midwife, you can still have an epidural and deliver in a hospital, right? If you have a midwife, you can be in a birth center. If you have a midwife, you can also deliver in the home setting. What we need to work on is making sure that that midwife you choose can maybe say, if you choose a home birth, they can then transfer to a hospital setting. So making sure that's a more smooth process so you don't have to switch providers. And that at Beloved Birth Black Centering and Highland Hospital is absolutely what they're doing. They are all, the midwives work with them, and the OBs only see them like if there's an emergency C-section necessary. And they also have doulas, and their model of care is all Black providers caring for Black birthing people. And it's pretty magical.
And are there any numbers? Let me ask you this, Kimberly. Hold on a second. Are there any numbers about the relative safety of using a midwife in a hospital setting versus using an MD? Are any numbers out about that, Kimberly?
Well, we know that Black birth outcomes improve under midwifery care and with doulas. And I want to just note that this is the standard practice in every other country. You give birth with a midwife unless you have a high risk situation. You go to Europe, you go to any place else, that is the standard practice of care. It is only here in the US where, as a standard practice of care, you are seeing a surgeon for a non-medical event. And I think that is what we have to recognize. What Rachel is explaining is actually the standard practice in every other country, right? And so this is the way that birth should happen. It is not a medical event. It was brought into hospitals not to help women, but to make more money, to profit from making it a surgical procedure, right? It is not about that. It is not a medical event. And a midwife understands it's a normal physiological experience experience of your body, and she's going to guide you and educate you through that. And they just have a different approach to what birth is.
Yeah, when we come forward, I want to talk about the use of doulas and how even places like LA County and others are starting to make doulas available to birthing people. Stay with us, KBLA Talk 1580. Joining me in this hour, Kimberly Seals Allers, founder of the Irth app and executive director of Narrative Nation, and Rachel Nix is here, founder, Birth Queen, because we are kicking off Black Maternal Health Week. Kimberly, tell us about this app. I know you've had it for several years now. I've seen you on social media traveling, talking about the app, getting hospitals signed up, getting other medical professionals signed up. So how can people get on the app? And once they're on it, what is it, what does the app do?
Yeah, such a great question. So Irth is like the word birth, but we dropped the B for bias. And Irth is the first of its kind Yelp-like tool for us to leave reviews of our OBGYNs, birthing hospitals, and pediatricians, right? On the back end, we turn those reviews into data to help hospitals learn from the living, as we say. Instead of waiting for another Black maternal death to recognize that there may be gaps in your care or bias on your teams, we can look at what's happening, look for frequency and patterns, analyze those reviews, and help hospitals create improvement plans. And that's what we're doing all over the country. We're excited. We're about to launch a special project in LA, as well as 2 other cities in California, all about asking the community to leave their reviews. So if you've given birth in the past 2 years, please go to the Google Play or Apple App Store, download Irth, that's IRTH, search in your zip code, see if there are any reviews, see what other Black and brown folks are saying about their experience of care, and leave a review. You can leave a review of your prenatal appointment, your birthing experience, your postpartum appointment, and your pediatric visits for your baby up to baby's first year, because we know what is happening to Black mamas is also happening to Black babies. So we want to inform and protect each other. We know that our community has power. We know that our stories have power. So we want to create this transparent, publicly available tool for everyone to use, but it only works if we put our reviews in it. And that's how we've sought to hold these hospitals accountable for their treatment of Black and brown folks.
So tell us about the projects in LA and some other cities in California. What are you looking for women to join? Give us more information about the project.
So we are working with 2 hospitals we have not announced yet. We'll have 2 hospitals who have come into our pilot project. And what they've understood is that they are not getting enough feedback from Black and brown folks. Black and brown folks are not responding to HCAHPS, Press Ganey's, all the hospital administered surveys. We just don't trust it. We don't know where it's going and what's the point, right? And so they don't have enough feedback about what makes a 5-star experience for us. And that's where we're coming in. But the way that we work, we are focused on being a part of the community. We'll have Irth Doula Ambassador. I know we're going to talk about doulas soon. We have an Irth Ambassador program where doulas can come in. We accept reviews from doulas. So Irth accepts reviews from mothers, fathers, doulas, and hospital-based midwives. So we want everyone, particularly in the LA area, to download the app, leave a review. If you're a mother, father, if you're a doula, we have a special icon in the app so that users know that a doula left that review. We want them to pay attention. And so this is what we'll be doing. And then after we collect those reviews and analyze it, we'll be looking at who's doing well in LA, who's not doing so well. And then we will be helping those hospitals improve their care based on what the review said was working and not working. And that is what we'll be doing. And then after our process is complete around 12 months, we go back to the community to make sure to hold these folks accountable, to evaluate the work that the hospital did. So this is the only community-led process, and we're excited about bringing it to California. We'll be replicating this in the Bay Area and in Sacramento as well.
Wow, congratulations. That sounds like incredible work, obviously much needed work. And Rachel, you're headed to LA as well. LA is hot this month. What brings you to Los Angeles?
I like put out there, I feel like in the fall, I was like, I'm spending Black Maternal Health Week in LA. So I have this, Kimberly and I, number one, are throwing a mixer to celebrate Black birth workers on the 18th at Credo on 3rd Street. So shout out to that if you can make it. But for me, my approach is all about bringing us together. So I am bringing together a group of amazing Black women, and Areva and Kimberly are two of them, on Saturday to really create a safe space for Black women just to convene, connect, heal, and amplify and activate change. And really my intention in the beginning of this is just to be like, how are you? Because we know Black women are not being listened to, and therefore that leads to our ultimate demise, whether that's our death or just our stress and mother load, right? We are always loaded. And so the goal of this, and my goal is to continue throughout the year leading into my first gala next year, is to allow women of influence and affluence to unload and for me to see them. And with our connection, really be able to create massive change. The community is very important, but I believe that if the top, right, is educated and really informed, then we can provide lasting and impactful change for the masses. So that's one of my goals, in LA is the first place that I'm starting that, and hope to go to Atlanta, New York, back to the Bay and beyond.
Well, thank you, beautiful queens, for descending on Los Angeles during Black Maternal Health Week. We welcome you with open arms. I know both of you will leave a lasting impression on the work that's being done on the ground here by so many organizations already. Yeah. And I mentioned that doula program, the LA County, the County of Los Angeles, one of the largest counties probably in the country, has started a doula program. So Kimberly, talk to us about doulas. Who are they? When does someone need a doula? What should that doula be doing for them? And how do you pay for them?
Okay, good question. First, let me just say we will be with the LA County Health Department at the Curtis Taylor Health Center in Inglewood for a community baby shower this Saturday. So come out, particularly if you're pregnant or a new mom. There's going to be plenty of resources there, lots of great times, and also we'll be there. You can leave your Irth review, and you can meet some of our doula ambassadors. So doulas are trained birth professional. Rachel is a doula. These are exceptional people who are there to really guide you through your pregnancy and birth experience and postpartum, right? We can't forget about that. I think there's a lot of focus on birth. One thing I want to say to folks about doulas is that many times there's a lot about doulas at your bedside at the birth, which is important. But for me, the real value of doulas is the education they provide throughout your whole pregnancy. That doula, she's going to teach you about what's happening to your body. She's going to help you know what questions to ask. I've had 2 C-sections. I still can't explain. And I wish I had a doula who would have taught me what questions to ask when you're being.
Kimberly, if you have a midwife, do you need a doula?
Yes, so 2 different things. Okay. So a midwife is waist down. She's there to catch the baby. And the doula is waist up. She's there to take care of you, right?
Okay.
So there are 2 different professionals, and they work together as everyone on your birth team should, right? And so the doula is there. They educate you. They can support you and advocate for you during your birth. As you know, after birth, everybody's concerned about the baby. Everybody forgets about the mother, but the doula does not forget about the mother. She's going to show up. She's going to make sure that you are okay postpartum. This is also a huge gap in the U.S. health system. Again, in every other country, as a standard practice of care, after you give birth, somebody's shown up at your house, usually a midwife, right? It is known that this is a very critical period. It's where breastfeeding either lives or dies. It's where a lot of times people have postpartum issues around their mental health. It could also be complications related to their pregnancy or their C-section. This is a critical time. A doula is going to be there for you postpartum, help you with your breastfeeding, make sure you're okay, take a few things off your plate to make sure that you can thrive and enter your mothering journey with ease and peace, right? And so we want to lift up their value. I am concerned that there's a lot of talk about doulas, that we don't want to lionize doulas. They did not create this Black maternal health crisis, and they are not the sole solution. It's very easy for the system to try to point a finger and look for a silver bullet, but they are just one piece, a critical piece, but only one piece in the changes that we need to really address this crisis in our country.
Wow, you're sitting here making me want to have a baby because I want to have a doula.
Me too,
I'll be your doula, Areva.
I'm like, oh, I missed that. I needed someone next to
Absolutely.
me caring for the, as you said, the waist up. Wow.
Right.
Okay, these women, and they're men doulas, right? Are there male doulas?
Yeah, a few.
There are a few male doulas.
few.
There are a few. There are
Okay.
a few.
Who pays for them? Because I think that's an issue that a lot of mothers have, particularly if it's not being paid for by your health insurance. Do you have to pay privately?
You have to pay out of pocket. However, a solution to that, because there's a lot of people in the middle that Medicaid is not going to cover. So Medicaid is now covering a lot of doulas in many states. So if you do have Medicaid coverage, please know that, seek that out. And if you're in the middle, it's really expensive still, right? So register for it. I think we've gotten in a time where we register for all of these things for the baby that they really don't need. And so instead, I encourage a woman and a mother to register for herself, what she needs to be fully equipped to be, resourced in the way she needs to heal and take care of her baby. Babies need very little, like maybe a diaper and a boob. That's about it. They don't need $1,000 stroller unless you live in Manhattan and it's like your car, then not fine. But other than that, they don't need all the things you do. You need pelvic floor therapy. You need a chiropractor. You need acupuncture. You need a doula. You need rest. Honestly, like if I could push anything as the multiple crown wearer that I am, please sit down and lay down and cuddle and heal with your baby. That is the best thing you can do for your body, for your baby, and your mental and emotional health. You delivered life and you need to take that seriously. You are not allowed to care for anyone else. And as Kimberly's been referencing other cultures take that, like the Asian culture in particular, take that very seriously.
Well, it's interesting. I'm just thinking back. I remember older women telling me that when they had babies in the hospital, they would be in the hospital for a week or even longer, and how much care they were given. By the time I had my baby, it was like, you got 24 hours, maybe 48 hours, unless you had a C-section and your butt was out of that hospital, you were at home. And a lot of folks were, we were forced to go back to work unless you had a job that provided you with some kind of leave. I've always been self-employed most of my life, so I haven't had that luxury. So I'm so glad to hear you say, Rachel, and you, Kimberly, too, the importance of recognizing that you brought life into the world. That is a huge thing. And I think in this country, we just gloss right over that. And like, okay, what's next? And we don't give nearly enough, time to pause and to appreciate how significant it is, the job that women and birthing people do in this country. That's why I'm so grateful to both of you for the work that you're doing, for raising awareness, for helping us kick off Black Maternal Health Week here at KBLA. This is an issue we take very seriously. This is a station that has tons of Black mothers who work at the station, who are engaged with the station. So this is an issue that's near and dear to all of us. Our producer said he and his wife had a doula. His wife still had a C-section, but I'm sure that doula was very helpful to Avi as well. Thank you so much, Kimberly. Thank you so much, Rachel. We're going to be looking for you on the ground in Los Angeles. This is Black Maternal Health Week. The next voice that you hear will be Robin Ayers and the Raw Report right here on KBLA Talk 1580.
Follow the leader. KBLA Talk 1580. Follow the leader.
Be sure to follow us on Instagram at KBLA 1580.
Follow the leader.
Are you ready?
The station leading the way with exclusive interviews,
Follow the leader.
stimulating conversation, and intellectual discourse that empowers, enlightens, and informs.
Follow the leader.
Follow the leader at KBLA 1580.
We've got a lot to talk about.
Keep following the leader.
Follow the leader. Follow the leader. Follow the leader. Follow the leader. Follow the leader.